Don Konantz is a 55-year-old father of four, husband and businessman who was diagnosed with prostate cancer at the age of 48.
It was an idle Tuesday at 4:30. I learned that the statistic 1 in 6 men get prostate cancer became for me 1 in 1. And that was the date of my diagnosis.
When we diagnose prostate cancer, really there are two large families of prostate cancer. Localized, which means that we're able to almost cure all patients, and there are metastatic prostate cancers that unfortunately are incurable, but we can still live a long time with all the new options we have.
After his initial diagnosis and related pathology from surgery, Don was informed that his prostate cancer was metastatic.
That diagnosis of cancer, it hit me very, very hard, and it was like the blackboard of my life of all the things that I'd hoped to do someday, all the hopes and goals and dreams that just went blank, and everything just fell off that blackboard.
But metastatic prostate cancer can be managed. The goals of treatment for metastatic prostate cancer: to keep the cancer under control for as long as possible and to improve a man's quality of life.
I asked, well, what's the next step? And they said, well, it's really now a systemic problem. And what we need to do now, it's no longer a local problem. We need to start giving you drugs.
In addition to receiving drug therapies for his cancer, Don's wife, his greatest supporter, suggested he consider running a marathon as part of his recovery.
And I learned that exercise, and especially vigorous exercise, is evidence-based to have a fantastic outcome. I told my family I'm going to do a full-course Ironman, which I saw as the ultimate physical test.
Don runs regularly with his family as part of his routine. His wife and running partner is also a dietitian.
We did a lot of homework in terms of what we needed to be eating, and we started eating differently. Plant-based, whole grain foods. Our cupboards didn't look like they did before a diagnosis of cancer.
Advanced prostate cancer is usually first treated with hormonal therapy that reduces levels of hormones called androgens, such as testosterone.
So prostate cancer, when it's advanced, meaning too late for cure, or patients who have metastases, we treat with hormone therapy. And hormone therapies are tremendously effective. Unfortunately, eventually men will become castration resistant. That means the cancer will progress, even though they're taking hormones with very low testosterones that are not feeding the cancer. So the cancer learns to progress even in the absence of hormones that they require for their survival.
When cancer comes back or doesn't go away after hormonal therapy, it is called castrate-resistant prostate cancer.
And my doctor told me I had to go 5 years with no sign of cancer. 5 months, and I got a phone call saying, your last tests, which I was doing every month, the test came back, and yeah, you better come and see us, and maybe we should rethink this Ironman.
Recent advances in the understanding of prostate cancer biology, derived from clinical trial research, have changed the way metastatic castrate-resistant prostate cancer is managed today. Today, there are treatment options available for patients whose metastatic cancer has progressed while on hormonal therapy that did not exist previously. These treatment options may cause certain side effects that vary depending on the specific type of treatment. Patients should always talk to their doctor about the best treatment for them.
So the availability of all these different options that we now can offer patients with castration-resistant prostate cancer has more than doubled the amount of time men live with the disease, have significantly improved their quality of life, and has allowed them to take advantage of life at home rather than in the hospice suffering of prostate cancer.
I'm living proof that research and excellence in cancer treatment matters, and my goal is for my kids and your kids that they won't ever have to deal with this in their lifetime.
Ongoing clinical trial research offers more than additional treatment options. It offers hope to both patients living with metastatic disease and the physicians who are treating them.
So if I have only one word to offer a patient who's newly diagnosed with metastatic prostate cancer, is the word hope. I mean, what we've seen over the last 10, 15 years, I think leads us to believe that there's always hope. I have examples of patients that I've treated that have come in at an era where we had almost nothing to offer, and just through their disease progressing, we've made discoveries year after year that have applied to that patient, and that patient has ended up living several years instead of just the 1 year we would have hoped in the past. So very optimistic.
Hope is something that no one can take away from you. Only you can give that away. And there's always hope. And I have a lot of hope. And I hold that hope very closely and very outwardly that we're going to meet this challenge.
To learn more about recent treatment options, as well as ongoing research within metastatic prostate cancer, speak with your medical oncology team and/or visit the website below, www.prostatecancer.ca/advanced prostate cancer.